So the resuscitation equipment for the newborn.
Yes.
Yes.
We also have resuscitation equipment for moms.
Yeah.
In our bag as well.
Yeah.
Which is basically we have a bag and mask for an adult.
Yeah.
Would be extremely rare that we
Yeah.
need to use that. And then we have bag and mask ventilation for a newborn.
Mm-hmm.
And it also has a CPAP function, continuous positive airway pressure, to help keep baby's lungs open.
Yeah.
Really unlikely that we need to use this at home birth because the babies have not had drugs.
Yeah.
So, and we've not had that same level of intervention and we've had a normal birth. We'd start in air and then if we needed to, we also have the oxygen that we can attach this tube to and give oxygen to the babies too. Yeah. We also have a spare bag there as well if we need spares. We've got maternal oxygen masks.
Have you ever had to use that?
Once we used it. If the woman's feeling very unwell with blood loss, we can give her some oxygen. Yeah. But
it's very unusual.
It's very rare. It's very rare, but we've got that.
But you can manage all that at home if you need to.
We can manage that, And in that situation, we keep that woman at home.
Something that's different, sorry to interrupt you, about doing any of this sort of resuscitation at home is that you do it all with the baby's cord intact.
Oh, yeah.
Which is evidence-based practice, making sure that they continue to get their oxygenated blood and on the mother.
Well, the evidence is they do much better.
Yes.
And you're much more successful with your resuscitation if the cord remains intact because they're still getting that blood and oxygen supply from the mother. If you cut that lifeline's gone. Yeah. So we keep them together as well, and keeping them together as well is better for both of them. Yeah. And we resuscitate with the baby on mom's lap because the cord is still attached and the placenta's still inside the uterus. So that's very different to hospital. Yeah. And we also have suction for newborn as well. Yeah. Rarely do we ever have to use it, but most likely time to use it would be with meconium. Yeah. But if the baby comes out and is not making any effort to breathe and there's meconium, then perhaps we would use it to gently suck out the baby's mouth and nose in that instance. And even rarer would we suck out the baby out because it was what we call mucousy. Most babies can clear that themselves and you can actually do damage if you do it routinely. Yeah. So again, evidence-based, we don't do that routinely, only if the baby was struggling to manage its own respiration.